gave a solution for the women. The first one gave awareness for the women, and the second one increase the education of the women for all things and know about their rights. Thank you.
Thank you. We move to the second questions from Erlangga. It's about reported cases in Malaysia and about premarital mandatory testing. Karina, please.
50%. I think that was actually Philippines that reported cases is 50% of estimated cases. But similar to the issue, however, in Malaysia the estimated is even worse. For 2007, it was estimated 80,000 population, and yet reported alone in 2008 is 84,000. So there is severe underestimation of the total number of HIV in Malaysia. But the 50% was actually Philippines, I think.
Okay. And the second question, the second question is about premarital mandatory testing. What if the testing is positive? What actions that taken for that couple?
There is quite clear guidelines in terms of the protocol of the conduct of testing for premarital, and it involves pre and post counseling as well for both couples. And for those who are found to be HIV positive, treatment referral is automatically made, and provision of treatment is free and provided by the government as well. Actually, I've got some latest numbers. Up till the end of 2008, close to 200,000 couples have been tested, and among those who are registering for the first time marriage, 0.05% were found to be HIV positive. But among those who are going for their testing due to second marriages, is actually higher, is 0.2% who are HIV positive. And only about 5% of those who tested positive during the premarital test actually continue on to with the marriage. So 95% actually did not get married after being found positive. Thank you.
Okay, thank you, Dr. Karina. The second question is from Monash University of Malaysia. This is about pre-employee testing. Anybody would like to respond to these questions?
Philippines.
Mr. Atenza and
Yes.
Roberto. Okay, please.
Okay. I think for the Philippines, this is also a problem in terms of the migrant workers that is cut of the country. So we do have a very significant number of PLHIV from the migrant worker sector within the country. That is considering that I think we do have more than 8 million migrant workers outside the Philippines. So I think the bigger issue in the country is in terms of the migrant workers being tested before departure or being tested before being employed without the required counseling. That's the key issue, I think. Because of that issue, it has grown a problem wherein some of the PLHIV would not really know their HIV status, and they would be actually in a very hard position in terms of accepting the reality of their being an HIV positive. So that is a growing problem for us, and we feel that testing should always be voluntary. On the other hand, as far as the employer is concerned, we believe, I personally believe that HIV prevention program should be implemented at the workplace, so that these people would be aware that it is not necessarily It is not necessary to know who the HIV person in the workplace is identified or known to them, but be generally cautious or generally be responsible in their behavior so that the HIV will be prevented.
Okay,
that's
thank
it.
you. Dr. Karina Razali, you would like to respond to this issue of pre-employee testing, please?
Okay, probably only on a few issues. I don't know it in detail, but one thing with regards to pre-employment testing, what is done is actually fitness to work assessment. Only when the job requirement for the specific job position, when there is assessed that there is a risk of HIV transmission, for example, frontline military personnel or those involved in the healthcare setting, maybe only when the job description involves some risk of transmission, for example, contact with blood, then a fitness to work assessment may be done. But an overall HIV testing mandatory as pre-employment, generally that is not recommended. What is recommended, however, is standard precautionary measures by the employers in terms of overall blood safety procedure and personal protective behavior as well. So that should be in place. So if the employee acquired HIV because the standard precautionary measures was not put in place, then there is some basis for maybe for a legal suit, I think. But I better not take my word for that. So basically, the standard precautionary measures are not HIV specific. It's general blood safety precautionary measures. And in that sense, it's not discrimination against people with HIV. And this should be in place anyway. Thank you.
Okay, thank you. Ibu Hesti, you would like to respond to this issue?
Yeah, a brief comment from me. I think, in my view, if we talk about the opportunity to get a job, I think in the principle of the human rights, so everyone must have opportunity to get job without distinction, everything distinction. In my view, test of HIV/AIDS not relation in the context to get a job. So I think this is a discrimination if we talk about the test of HIV/AIDS following the test to get a job in the every field. I think this is my view. Thank you.
Okay, thank you. Let us move to the second group, which are University of Hasanuddin, Timor-Leste, and University of Udayana. University of Hasanuddin and Makassar, do you have questions for the speakers on stigma and discrimination issues? Please. Hasanuddin. Okay, we're still waiting for a response from University of Hasanuddin. We move to University of Udayana. We move to Timor-Leste. Timor-Leste, do you have questions for the speakers?
Thank you.
No
yes,
question?
Thank you, Professor Ishar. We are apologies for being late because we were ready here early in the morning, but due to connection problems, we were not able to have the presentation from Malaysia. Only from Indonesia we have all the presentation from Dr. Hesti. And from our side, we have one question, maybe only one? Two questions. Okay, you go on.
Yeah, I'd like to ask to the Indonesians regarding to the human rights. So as you have stated to your presentation, that within the hospital as well, some of nurse or the staff within the hospital, they have kind of violence as well towards the patients which live with HIV. So, what kind of solutions that, what kind of the reactions from the government and the institutions that you work for?
Professor Izar, we still have another question. May we have another question?
Yeah.
Okay, thank you. Thank you. From Malaysian presentation, we were only able to appreciate the last bit of her presentation, and it was mentioned premarital mandatory test. And I want to know what is Indonesians' view of this premarital mandatory test. Because Indonesia presents some principles that we have to take care of, such as non-discrimination, human rights violations, equality, etc., etc. So suppose that a couple, particularly for the Muslim couples, they are subject to premarital test. In case the couple is tested positive, they are not allowed to get married. And I'm afraid if that is so, they will spread the virus everywhere. So my opinion, it would be much better if just let them get married with the condition that they should not be allowed to bear children. I think that is much better than just restrict them their need to get married. Thank you. Back to you.
Okay, thank you. Let's move to University of Diana first before we have a chance for the speaker to respond. University of Diana, do you have any questions?
Yes, thank you. I have some question. From the experience of the three countries, we can see that stigma and discrimination is one factor that determine the condition of people living with HIV and also their family. So from the experience of you as people who active in the HIV prevention and maybe treatment program, is there any measure that can be taken to reduce this issue? And my second question is regarding the employment. What is your comment about the disclosure of HIV status of employment? Is it we need to disclose their HIV status or not? And the last one for the Malaysian speaker, regarding the mandatory premarital testing for HIV. This is quite interesting because I think it's violate the human right of the people who are going to get married, because the testing should be conducted voluntarily. Can you give me a comment about that? Thank you.
Okay, thank you. Let me give the first chance to Ibu Esti to respond on the human rights violation in the hospital with regard to treatment for HIV/AIDS positive patients.
Thank you very much for your question. How about the reaction of the government of Indonesia? Komnas HAM, for this issue, Komnas HAM have gave recommendation to government of Republic of Indonesia and also to local government to fulfill the right of the person with HIV/AIDS in the every hospital in Indonesia. Why Komnas HAM gave a recommendation to the local government? Because in the law on local government stipulated that health issue responsible by local government. So local government must be take the responsible to fulfill person with HIV/AIDS about the in the medical. This is a reaction for the government, and also Komnas HAM already have a letter for the government. They will effort to fulfill the right of the person with HIV/AIDS in the many regions in Indonesia. Thank you.
Okay, there are a couple of questions about premarital mandatory testing. Karina, would you respond to these questions? Hello?
I think about it as a violation. Hello?
Please, yeah.
Okay, my simple response to whether it is a violation of human rights, absolutely yes, and that's a personal view. But having said that, we as a nation has to deal with the fact that it has already been adopted and put into place as a policy. And initially it was initiated by state-level religious authorities, and then adopted by at the national level, high-level decision-making. So in terms of what to do now that it's already been put in place as policy, I guess what it takes is for some organizations to pull together their resources and take the helm in trying to reverse this, or starting a dialogue and communication with the religious authorities and the decision makers in terms of probably giving them more information and balanced argument why we are against this as a policy, and then hopefully we can move forward from there. But in terms of it has been done, the policy is in place, so my opinion would just be an opinion, and I know quite a number of NGOs and individuals who are in agreement with us that it is a violation of human rights.
Okay, thank you very much. We respect your personal view. Let me move to the Philippines. If you have any comment and on these issues, and also probably you could respond to the issue on the employee testing. Should we disclose it or not? The Philippines. Do we lost Philippines? No response from the Philippines. Hello. Okay, Ibu Hesti, do you have any questions about the pre-employment testings of HIV/AIDS? Should it be disclosed or not?
Yeah, again, in my view, I think not necessary to disclosure the medical record, because when I already mentioned that this is a privacy, so nobody knows about the information of the our medical record in the many fields. In this occasion, to get a job, I think not relevant to have tests of HIV/AIDS because this is privacy. Thank you.
Okay, this actually questions from Timor-Leste. What is the Indonesian view on the premarital mandatory testings? What is your view on the premarital mandatory testings?
Yeah, I think again this is a human rights violation, because this is again and again this is privacy. So I think not necessary every women to have the premarital about the HIV/AIDS, but maybe for the couple, yeah, this is important for their couple to know about everything of the health of the another couple. I think like that. Thank you.
Okay, let us move to the third group. University of Indonesia at Salemba. Do you have any questions for the speakers, please?
Good morning, Ms. Hasti. I have two questions. The first one, maybe you can explain further about what's been done by the Indonesian National Commission on Human Rights to reduce the stigma and discrimination of HIV/AIDS in Indonesia proactively. And the second, what target does the Indonesian National Commission on Human Rights want to achieve in reducing the stigma and discrimination? Thank you.
Thank you. Now we move to University of Indonesia at Depok. Depok, do you have any question?
We don't have question now. Thank you.
Okay, thank you. Ibu Hesti, please.
Yeah, I can't answer clearly about your question because we must talk first in the Komnas HAM. So if you talk about how to reduce the stigmatization, I think we must awareness to society about the right of the person with HIV/AIDS, about the rights of the person in the LGBT rights. So this is part of our duty, how to give awareness to society about the rights for the vulnerable group and also minority group. And then the target of the Komnas HAM to reduce, I think, the manner of the law number 39, 1999 on human rights stipulated that Komnas HAM have a function to eliminate and how to have a program to promote and protect human rights for all human beings, for citizens in Indonesia, as well as I think for a person with HIV/AIDS. So the target of Komnas HAM, how to eliminate, combat all the issue, human rights violation for the all citizens, for the all human beings living in Indonesia. Thank you.
Okay, we still have about 10 minutes to all sides. If you still have any burning questions, please ask your questions now.
Okay, Ms. Hasti. Is there any program that has been done by the Indonesian National Committee on Human Rights to reduce, not the future program, but what has been done now to reduce the stigma and discrimination? Thank you.
What has been done?
Actually, Komnas HAM have periodically of the member of Komnas HAM. So if we talk about my periodically 2007 until 2012, we don't have enough information about the program of Komnas HAM with regard the issue of HIV/AIDS. But in the last activity of the Komnas HAM periodically 2007 until 2007, they already have the program to reduce issue of the HIV/AIDS to the society, because we have a subcommission on vulnerable group, and one of this issue of the how to reduce HIV/AIDS in Indonesia. We already have result of the research and study on the issue of HIV/AIDS, and also we already have program on to awareness civil society on the issue of HIV/AIDS. 2006 and 2007, I think. Thank you.
Okay, thank you. We are now closing the sessions. To all the 3 or 4 speakers, if you still have any comment, Philippine, do you have your last comment on these issues?
From the Philippines, we would like to thanks the facilitator and the organizer for giving us this opportunity from the Department of Health and the Positive Action Foundation Philippines and the rest of the civil society organizations working to reduce stigma and discrimination in the Philippines. We would like to thank you for giving us this opportunity.
Okay, thank you. Dr. Karina Rosali, do you have any additional comment on the issue?
Yes, please. If I may comment a little bit on the suggestion about even if we allow HIV positive people to marry but not allow them to have children. I would disagree with that view in the sense that that too is a human rights violation in terms of the right for people to have children. But what we should push for is increasing education and awareness so that couples can make informed decisions whether or not they want to have children, knowing that one of them is HIV positive. And there's also the role of prevention of mother-to-child transmission. With treatment, transmission from mother to child can be reduced quite significantly. And another issue with that is where do we stop? It won't be just about HIV. In the not too distant future, there will be genetic testing and other diseases that are passed down from parents to children. Where do we stop from telling parents not to have children because of the possibility of children having whatever you have? So that's my view in terms of that comment. But apart from that, it has been a very interesting session. Thank you for all participants and great questions for everyone. Thank you.
Thank you very much. Ibu Hesti, do you still have any questions? Any comment?
Yeah,
it will be the last comment.
Yeah, in my view, if we talk about HIV/AIDS, so we must talk about two things. The first one, we must talk about the right of person who suffered with HIV/AIDS, and the second one, we also must talk about the rights for the society from the transmission of HIV/AIDS. So this is part of the human right issue. So how to eliminate violation of human rights in many fields. Thank you very much.
Okay, thank you. We are now close to questions. Thank you very much for all the speakers and all the participating sides. Okay, we are having break, a 5-minute break now, then we will continue with the synthesis for the course. Thank you. We'll be right back in 5 minutes.